Brush your teeth. We go up and down and round and round. Hey friends, Dr. Goals with Dr. Goals Optimal Living Institute. Do you brush your whole mouth? So I went to the dentist recently and the hygienist was saying, you know, are you brushing the roof of your mouth, all the gum lines, around the gums? And I was like, no, I brush my teeth. But she's like, no, you got to get all the way in there because of those crevices. The reason too is we want to reduce that plaque. And what is plaque? It's that kind of clear substance that forms when the bacteria in our mouth is digesting sugars or starchy foods. And if we don't remove that plaque, it can build up, and what happens, it can turn into tartar. So plaque is clear, generally speaking, or yellowish white, but that tartar is a discolored brown, and it can harden, it can start to ruin the tooth because it'll erode the enamel and then lead to cavities. So I don't want that. I know you don't either. So brushing your teeth at least twice a day for 2 minutes. You can use a manual or electric toothbrush. Some of the studies show the electric toothbrush, if you are making good contact with the tooth at a 45-degree angle, it can reduce plaque pretty well. So I do recommend the electric toothbrushes, soft bristles, because you don't want to scrape the tooth too hard, and you definitely don't want to use your nails or anything like that. Anything abrasive, you can damage the tooth. The other thing that I like, and the ADA does recommend fluoride toothpaste. Tongue scraper if you're dealing with any halitosis, just the lower third of the tongue, just kind of scrape down. You'll get the deeper bacteria removed, so the whole overload of that bacteria goes down, and it does remove the compounds of sulfur that can build up, which can lead to halitosis. Water pick, also really, really good. So I had a lot of issues with my teeth, so this has made a huge difference for me. You can use a water pick for about 2 minutes, and again, just going in like circular motions around the gum line. I call it upside down use on the outside and inside of the mouth around that tooth. So really, really important to take care of your mouth because we want to reduce illness. We want to feel good and have good breath, and also that's a nice little added benefit, but important because for overall health, we want to see you well and thriving. So Dr. Goals with Dr. Goals Optimal Living Institute, make time for you. You can do these 2 minutes, and this is that no extra time. I sometimes do my squats while I'm brushing my teeth. I'll do a yoga pose like tree pose, or stretch. Or you may want to just laugh, ha 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 ha, or smile out. Whatever works for you. That's the important part. Dr. Goals, the Dr. Goals Optimal Living Institute. Your health matters. Toodles! Mwah!